Fellow Nigerians and friends around the world, good day to you all. When I was first appointed by His Excellency President Bola Ahmed Tinubu in August 2023, he made it very clear to me that he expected a unified and harmonious approach to transforming our nation's healthcare system with a keen focus on improvements from the base all the way up to secondary, tertiary, and quaternary care. As a former Chief Executive Officer of the National Primary Healthcare Development Agency here in Nigeria, I knew that the President's mandate was well considered, and thus quality healthcare provision at the grassroots of our country remains to be a major focal point for all our efforts towards re-engineering healthcare delivery in all the 774 local governments and 36 states of the Federal Republic of Nigeria. One of the major vehicles that we are using in our effort to transform primary healthcare is the Basic Healthcare Provision Fund, which was established in 2014 under Section 11 of the National Health Act. The Basic Healthcare Provision Fund is an anchor for our sector-wide approach and provides funding for an additional resource base for subnational units, that is our states and local governments, to leverage upon in our collective bid to enhance access to primary health care across all parts of Nigeria. Designed to be financed from at least 1% of the federal government's consolidated revenue fund and also other sources, including donors' contribution, the fund provides a basic minimum package of health services aimed at increasing the fiscal space for health, strengthen the national health system with an implicit understanding the healthcare ecosystem will only be as strong as its foundation, that is the primary healthcare system. From 2023 to date, more than 50 billion naira has already been disbursed directly to more than 8,000 primary healthcare centers across the country through the fund. And this has led to increase in the functionality of the primary healthcare centers, alongside many more ongoing PHC rehabilitation projects across all local government areas of Nigeria. More specifically, under the leadership of the President, the federal government is working with state governments through the IDA Impact Program to support the revitalization and upgrade of thousands of primary healthcare centers across all states and the Federal Capital Territory. This over the past 2 years. In fact, 37 million visits to primary healthcare centers have already been recorded in the first 3 months of 2025 alone, predominantly in our population living in rural and marginalized populations. This is coming at a time when, through the National Health Insurance Authority, NHIA, which is working with states and the private sector, has expanded enrollment nationwide by 4 million Nigerians to reach 20 million Nigerians covered for the first time in Nigeria's history. This added greater affordability and accessibility to the lowest income strata of our society, in line with the core tenets of the Renewed Hope agenda of Mr. President. So even as we upgrade facilities and enhance recruitment of primary healthcare workers, nurses, midwives, we're working to ensure that our people continue to effortlessly access the services that they deserve. We are unifying the Nigerian health sector under the sector-wide approach office led by its national coordinator, Dr. Muntaka Umar Sadiq, which has brought together civil society organizations, donors, states, local governments, and relevant federal institutions to drive one common agenda for development in the Nigerian health sector in a verifiable and transparent manner. We have equally recruited and trained a new set of young Nigerian leaders who we rely on to drive the future of our public health system, with each young leader emerging from a rigorous screening process. Our National Health Fellows. Every local government area of the country has now produced one young leader who will help us to drive the process of local accountability, quality assurance, as they help us supervise the operation of the upgraded primary healthcare facilities and the services that are being provided in them. At the tertiary level of care, of course, we are already trying hard to bridge the access gaps in the country, especially in the northern part of the country where there are huge gaps. And this is with the consistent support of President Bola Ahmed Tinubu, with whose support we have already executed more than 300 projects across 35 tertiary hospitals in the northern part of Nigeria, serving over 4.5 million patients in the outpatient department and 1.6 million inpatients in the northern part of Nigeria. Under the empathic and strong leadership of the President, Nigerians can and should expect that the total transformation of the nation's primary healthcare system is not only going to continue on course, but has already started manifesting tangible results, and there are real testimonies from Nigerians who previously did not enjoy access to the modern facilities that they now do, alongside the testimonies of Nigerians who could not previously afford or access quality care at the primary healthcare level or at the higher levels of care. So I urge you all to keep faith with us as we work to deliver on Mr. President's reform agenda across the sector. We are confident that President Bola Ahmed Tinubu will succeed, and ultimately every Nigerian will benefit as the President continues to do the hard work that he has been elected to do so. Thank you, and God bless the Federal Republic of Nigeria.